Brown is next.
Thank you, Chairman Wyden. Mr. Chairman, I asked that written testimony offered by the Director of Pediatric Psychiatry and Psychology at Akron Children's Hospital be included in the record for today's hearing.
Without objection, so ordered.
Thank you, Chairman. Mr. Chairman. Dr. Benton, as you probably recall from your time some time ago spent in my state for medical school, Ohio has excellent children's hospitals in pretty much almost every part of the state. Cincinnati Children's, Dayton Children's, nationwide in Columbus, Akron Children's, Rainbow Children's, and Northeast Ohio, home to several outstanding pediatric, as you know, pediatric, not podiatric, centers of excellence. Despite the resources our state has, Ohio's children and health workers are still struggling during this pediatric mental health crisis. Ohio's, just like counterparts across the country, our children's hospitals need our support to rise to meet the needs of children and adolescents and address this serious public health crisis. Experts tell me that one of the biggest challenges is meeting the needs of multi-system youth. Could you talk about action, Dr. Benton, actions Congress can take to better support children's hospitals in their work to support youth served by multiple systems? For example, those who are in foster care or justice involved or have a developmental disability in addition to a mental health diagnosis, and how can we ensure effective communications between and among juvenile justice and child welfare systems to best support these children who so often just get left out?
Well, thank you, Senator Brown, for that question. And just for you to know, Cincinnati is my hometown, so I am an Ohioan. And so I just wanted to say that that's an excellent question and one of the greatest challenges that we face in mental health care now. So that the systems in which children exist, as you've highlighted, child care, education, juvenile justice, foster care, and others have little or no collaboration. And systems are actually not in place to facilitate that collaboration. The attempts to coordinate it are either baffled by bureaucratic challenges or unwillingness to acknowledge that the systems are actually connected. And so what would be required is a focus on requirements among those organizations that there's better coordination. We talk often about case management, as a broad term, but those individuals are often the ones who are facilitating communication between organizations that do parallel work, caring for the same kids, but don't necessarily have an effective means for coordination. Some of the data shows us pretty clearly that about 50 to 75% of over the 2 million children who are adolescents in juvenile detention actually have had limited mental health treatment or limited mental health support. And so, essentially, um, ex- communicating expectations that those agencies collaborate around the care of the same kids by establishing systems that facilitate that could go a long way. For children's hospitals, we struggle at times with children who are admitted to the children's hospital with a medical condition and a mental health condition. The medical condition is resolved. The mental health system issues are resolving, yet they're waiting for placement in foster care, sometimes remaining in hospitals for up to a year. And at that juncture, payers are not accountable. The agency who acts as the parent is not accountable. And then the hospital is accountable for providing all of those services that require multi-agency collaboration. Expectations of accountability for those agencies who are often managed by federal governments and states would be essential for being responsible for coordinating care of young people.
Thanks, Dr. Benton. I have a question that I would like all of you to answer, but very briefly because my time is short and the chair is always tolerant, but his patience probably worse than. I asked the Surgeon General last week how we better integrate mental health services with our schools. And my question to each of you, based on actually Dr. Benton's hometown, there is a community school in Cincinnati, Euler, which has become a bit of a template for the whole country, the whole state and the whole country. Briefly describe, if you had a chance to offer a suggestion, one thing schools can do to leverage relationships with community partners, state or local health departments, hospital service centers, whatever. Just give one simple recommendation of what we can do better, schools can do better to leverage that. Dr. Hoover, you want to start, and then Ms. Lebarsky, and then Trace, and then finish with Dr. Benton briefly. Thank you.
Happy to. Thank you, Senator Brown, and familiar with the school in the Cincinnati area that does this well, and as you said, serves as a model for the nation. So one simple thing that can be done, there are good templates for memoranda of understanding and requests for proposals that can go out to districts to solicit community behavioral health partners to come in and engage in school behavioral health provider services in the schools. Instead of it just being kind of a hodgepodge of services, it can be organized through a request for proposals process with standardized memoranda of understanding with community behavioral health.
Thank you. Ms. Lebarsky next, and then Trace.
Sure. And first of all, I'd say go Bearcats as a graduate of the University of Cincinnati. This is something we've done really well in our community. It's really establishing not only those agreements of understanding, but it's really finding a standardized assessment tool that schools will feel comfortable utilizing in order to be able to do that screening, to pass it on to the behavioral health care, whether it's utilizing our mobile crisis team at the center for a youth who's going into crisis in the school setting, or being accepting of the behavioral and mental health supports that our staff can provide. So I think using some standardized screenings that school districts feel comfortable with is one step in that direction as well.
Thank you, Trace.
Yeah, I also think part of the big reason is we need to invite youth and kind of see what they actually want and what resources would be helpful for them, because it's one thing to offer resources and it's another for teens to actually access them. So when we conduct needs assessments and really see what works for youth, I think we'll experience better outcomes in that regard.
Well said. Thanks. Dr. Benton, close with you. Thank you, Mr. Chairman. Go ahead.
Thank you. I just want to say that I support all of those things that were just mentioned and putting a system in place to make sure those things can happen easily and accessibly.
Thanks, Mr. Chairman.